we're here to discuss the carers survey that we undertook as part of a commissioning piece of work that we were doing. Now, it also just mentioned on this first slide here, on the cover slide, my manager, Jill Owen-John. Unfortunately, she's unable to attend today, but I do have my colleague here, Sarah Statham, who's kindly stepped in. So if there's any specific queries around that, then hopefully between us we can address any questions that you have. So thank you very much, everybody, for your time today. I know Simone said that you don't normally have people coming to talk at you, so I appreciate you giving us your time today. If we could move on to the next slide, Simone, if that's okay. Great, okay, thank you. So just to give you all a bit of a background in terms of what we currently commission for carers as a council. So we have a mental health specific carers support. So they provide assessments and general support services for carers of those with mental health conditions. We have the same sort of service again in terms of the provision of carers assessments and support services aimed at young carers and young adult carers. We also, through the Wellbeing and Independence network, so through the WIN, we have a worker. We have a worker that we fund there who provides specific support around social engagement, volunteering and work. And we've also been running a carers assessment pilot, so delivering carers assessments and support services for informal carers, and that's more being mainly based at adult carers, for which we didn't have that provision in place for really at the moment. And if I could move on to the next slide, please. Right, thank you. And this slide is really just to detail some of the generic commissioning that we have around our preventative services that often carers access or can access these services as well. So I think hopefully you may well be aware of many of these services already. So we've got the Prevention Alliance, who provide advice and guidance and some one-to-one work with to address wellbeing with individuals. And then we've got the various Wellbeing and Independence networks. So we've got the WIN at Home that are providing practical support to help people remain safe and independent in their own homes. And then we have the WIN in the community, which has been providing one-to-one and group support to help people engage the community and to help reduce social isolation. And then we've got our WIN community transport, which is our enabling service. So it allows those that are unable to use public transport so much, and it provides accessible transport for them to access some of these actually services that, for example, that are run by one in the community, but other things as well. Next slide, please. Thanks, Simone. So why are we here today? Well, why did we do the survey? Well, there's some issues with the present commissioning that I've just outlined for you, and a lot of this was around really we had what we felt insufficient assessment going into carer specific services at the moment. Certainly more for the more generic adult carers, that there was not sufficient services being funded for them, although they did have access to our generic services, and I'll come on to this in a minute. We felt there was an inequality of provision, so some service were being provided for some groups of carers, but not so much for others. And you probably have seen from the previous slide in terms of the support services that we were providing for those of carers with mental health and those of carers of young people and young adults. They had support services, obviously, and access to assessments, but some of these support services weren't being commissioned really for adult carers at the moment. So although they are being provided through yourselves in the voluntary sector. And some of the generic services that we do use for the prevention services, so for example, the Prevention Alliance, they do tend to refer on to the specific carer services when they need to have that expert advice, and these weren't really being currently funded. Next slide, please, Simone. Thank you. So this led us through to developing a carer survey. We wanted to look into providing a service to address these inequalities and to provide a service that was suitable for all carers across Stockport, depending, you know, and it didn't matter what you know, condition that they might have. So we tested the market, and we saw that, you know, some people would be willing to provide a service for carers. So we wanted, obviously, and it's the first step in many kind of commissioning, when you start to commission, is to get that feedback from those people using those services. Obviously, you know, carers themselves are using these services, and it has to reflect what they need and want, and obviously they are the best people to ask. So we did an online survey. It lasted, I think, hopefully many of you have seen the survey. It was circulated through the voluntary sector routes, and that took place between the 7th of December and the 4th of January. We had 349 responses, which we were quite pleased with, considering that the timescale that it was out for. And like I say, it was an online survey, so it was sent out to our commissioning partners already. We sent it via the VCSE forum. We had contacts through Team Around the Place, so they circulated it. It was promoted on social media and sent through partners such as the CCG and Viaduct, and obviously through the council's own communication systems as well. Next slide, please. Thank you, Simone. Sorry, I just have to take a sip of juice. I've just got a bit of a dry throat today. Okay, so the survey itself. So in terms of the respondents that filled in the survey, I mean, some of this information that we've got back might not be a surprise to some of you, but it gives us a clear idea of the current picture amongst carers, you know, across Stockport. And you know, in terms of who people are caring for, overwhelmingly it is another relative or a partner. Generally is who people are caring for, and the cared for person is most generally an older adult. Specifically, we saw, you know, most of those being actually over 75 years of old for the age of the person that was being cared for, closely followed by the kind of 65 to 74 ages, and also and then the, you know, the younger category, you know, 17 and under. Next slide, please. Thank you. We also, you know, asked about what kind of conditions that the person that they were caring for had. We tried to put across much of a range of conditions as we could. And the most common ones in terms of the people that we surveyed were caring for people with Alzheimer's or dementia or a physical disability, but there is a widespread coverage of various other reasons across there. We also looked at their current position in terms of whether they were in employment or whether they were in education, just to see whether there was you know, the caring role was having any effect on their lives in this respect. Most of the people, as you can see in the bottom graph, most of the people that filled in the survey were actually retired or not in paid work. So there is a few that are affected in terms of employment, but mostly they were retired. Next slide, please, Simone. Great, thank you. So one of the first questions that we kicked off was, are you actually caring for someone at the moment? And that will be reflected in the rest of the answers. 83% of people, so most of the people filling in the survey, were currently caring for someone. There is a small percentage that weren't at this current time, and some that have never been, but the majority of people filling in the survey and the feedback that we're getting are directly from carers that are currently caring for somebody. Next slide, please. So we want to know whether people had accessed any of the support services available for carers within the last 12 months. Now, obviously, when the period of time that this survey was covering, really, most of the majority of this period was during the COVID pandemic. So we had probably a couple of months, I think at the beginning, maybe January, February, a bit of March, where where things were, what we all refer to now as normal. So during that last 12 months, a lot of people had access services, 44% was the most. And those, yes, but not in the last 12 months, 20%. So largely across the board, people had access services, but there's still, just over 30% there that had never accessed any services at all. Next slide, please. So then, how do you access services? Was the next question we asked, and again, this is where the point in terms of the COVID pandemic comes into mind, in terms of obviously how they were able to during the last 12 months, and obviously during most of that time, a lot of those face-to-face opportunities were not really in place. So there were a lot here. 58% didn't answer the question. I'm not sure what that means and what we can take from that. But of those that did access services, mostly by telephone, and then follow not too far behind was online provision, and the smaller percentage was actually in person. But as I've said, that could a lot of that could be due to them not being able to do that during this very much during this past 12 months. Next slide, please. Okay, thank you. So this is in terms of how difficult they have found accessing support during 12 months, and obviously again we've got the COVID pandemic very much in mind here. Again, a lot of people didn't answer this question, so I'm not sure again what we can take from that. And those that did answer the question, most found it quite easy, but not that far behind at all. Some find it quite difficult. So it's a bit of a mixed bag, really, in that respect. And what I did in terms of the comments that we had in terms of how they'd access support and how easy or difficult they'd found it, we had a lot of comments here, so I did try and group them together in terms of themes, just to focus what those core reasons were. And if you see that graph on the right hand side, most of those, that big column in the middle, was due to reduction or closing of services. So again, probably quite closely related to the pandemic. And I think some of that is reflected in a couple of quotes that I've put below. I'm sure some of you are probably going to be asking whether I'll circulate the presentation. So with all these quotes and stuff in mind, and the graphs, you probably want to have a little peruse of those. So I will make sure that it's circulated. I think someone is obviously projecting it, so she's got that anyway. So yeah, so just for example, this quote on the left hand side, somebody was hoping to join the drop-in sessions and has joined by Zoom instead, but feels that face-to-face was more helpful for them. Whereas on the flip side, in the other quote, they were saying, well, actually, accessing services via the telephone actually gave me a bit more flexibility in terms of not having to find someone to sit with the cared for person, and they were able to access support a bit easier in that respect. So you can see the two sides to that there. Next slide, please. So one of the other questions we asked were what has been most beneficial to you in terms of the services that have been provided, and we did get a lot of quotes through from people on this, which is really, really good. We've got a lot of kind of direct thoughts from carers through, which I think is going to be very helpful for us. And they said, they need staff. Just to highlight a few of those quotes there, they need staff, professional staff, who understand the challenges they face and can provide that appropriate support. Others have looked at having, again, someone on the end of the phone, counselling was and a listening ear, or all the different things that carers have mentioned that they would find most beneficial. Next slide, please. So we asked in the survey, do you think that the current services that we do have support you in your caring role? Again, as I've indicated in another couple of the results, there is that there are a lot of people that didn't directly answer this question, but those that did, so yes or partially, with only the lower percentage saying no, they don't think they support you at all. Next slide, please. So we asked next, what were your priorities? What's most important to you? And there's a few things. So I think the most important thing that came through, 57% of respondents said that their priority was balancing their lives with their caring role, and closely followed was improving and maintaining their health and well-being. Being recognised, acknowledged and valued as a carer was closely behind that, and also to be socially active and not to become lonely or isolated were again the main things that came through on that question. Next slide, please. So again, here's some of the priorities, the quotes that came from that specific question, and some of them just highlighting that actually, all of those points, all those priorities that you've listed on there are actually important for me, and obviously, the concern that for their cared for person to making sure that they were getting all the help that they needed was there as well. Next slide, please. So again, we wanted to know what kind of service that carers would like going forward. What are the main priorities that they would like to see? So the overwhelming feedback here was that they wanted that information, advice and guidance, and kind of closely followed by welfare benefit advice specifically. Again, enabling respite for carers was closely behind that, as well as support groups for carers and for ex-carers, and counselling, closely behind that. So those were the main priorities that came through in that question. Next slide, please, Simone. So again, these are the comments that also people added into this question, and many of them said that actually three is not enough. They're all absolutely essential and so needed. One of the carers is saying there they're looking for a dedicated office or a dedicated contact point, because they felt that there's so many contact details and so many different organisations to go through that could be confusing in itself. So a kind of central hub almost seemed to be an idea that they would like. Next slide, please. Again, one of the quotes here highlighting that all of the above, you can't really narrow it down. And again, a one-stop shop, as I've just said, and just making sure no one's missed out there, and not everyone fits into necessarily the boxes that that people are generally put in. Next slide, please. And so challenges for carers, we asked them, what are your main challenges? And we got a lot of feedback on this question. And if we just look at the kind of graph in the middle, I know it's a little small for me, it may well be a little small for you, but like I say, the presentation will be circulated. I think that the biggest one on here was accessibility. So this is where I've analysed the kind of theme from all the quotes that we got through, and a lot of the comments were around accessibility and the type and the speed of getting support. The caring role itself was another, and as we've seen before, is respite and sitting services. And a couple of quotes there in terms of how carers have felt in terms of the challenges they felt. It's about being able to leave their cared for person, the effect that it has on their lives and their relationships. And obviously there's a point there around hidden carers, that some people don't want to identify as a carer in the first place. Next slide, please, Simone. So some more quotes here, again, outlining the need for a central point of access for carers to bring their queries to, and to have people who understand their circumstances. Also, let's not restrict everything to online access. Not everyone has access to online services, and the difficulties there is for carers to accept help for a loved one. Some of them, can often find that a hard thing to do. Next slide, please. Oh, more quotes. I put a lot of quotes in, hadn't realised. So again, that shows the difficulties that a carer can face in their in their day-to-day life, in terms of be able to get out, to either access shopping, etc., whatever they need to, or just to have a break for themselves, and the challenges there in terms of not only for them and also for the cared for person. So obviously when you get this presentation, you can have a proper read through of exactly what's in those quotes. I won't read them out now. The next slide, please. And so those were the kind of summary. I hope bit of a whistle-stop tour in terms of the main areas that came out of the survey. So obviously, going forward, we've listened to that carers' feedback, and our commissioning plans have changed slightly, in the fact that we've extended our current carers' contracts so that we can look at carers specifically as part of the preventative services commissioning for 2022, so that we will have, and our aim here is that we will have increased investment to really do this properly, and to deliver a good and robust carer service that would meet the needs of all carers across Stockport, which is what we really want to do. We want to do this well and to do this properly. So we feel that waiting slightly to commission something with increased investment would benefit everybody. So that's where we are at the moment. I hope that made sense. I don't know if anybody has any questions for me.
I've got like a couple.
Hi, Claire.
Hiya. It's kind of, well, I suppose it's sort of less of a question, more of a, yeah, I'll just say it because it would make more sense.
That's fine.
Yeah, one is doing the survey, and the fact that obviously at the moment everything we do, literally everything bar nipping to Asda has to be done online. So is there any sort of plans to try and capture any info in any other format? And my other thing was, one of the things that kept popping up was lots of the carers had fed back that having this central point. Yeah. I tend to not deal much with adult social care, but Space does deal a lot with families. And there did used to be a position where if there was a child who had a special educational need or a disability, that the families there used to be a central point that they could go to, and this one person would then signpost them to different places and would sort of point them in the right direction. And it sort of disappeared, because presumably that was somebody's job that at some point someone decided to stop paying for. And I'm wondering whether the adult social care was similar, in that it did used to exist and now it doesn't, or is this like a completely new thing? Because the idea of, if you need to deal with lots of different services, having one person to go to who can tell you firstly that things even exist, and secondly how to access them or which way, is a massive thing. So I wasn't sure whether that was something that did used to exist for adults that doesn't anymore, and now you're bringing it back, or whether it never existed before, because it definitely did in terms of children with sort of disabilities and additional needs, and it was just sort of phased out over time. So
thanks for that question, Claire. So in respect to getting information and feedback and in other formats, I think absolutely now, because we've done this survey and we've got a good set of, as you can see, a good set of results from that. But I think going forward, now that we're doing it as part of the preventative services commissioning, is that it allows us more time to do more further consultation. So I think certainly that will take place. So I'm not going to say necessarily yet in what format that will be. I don't know currently, but it's certainly, we have the time to do that. And obviously we will be consulting with yourselves as the voluntary sector, because many of you are working for organisations that work closely with carers. So absolutely, you know, as soon as we're ready to do that, we'll be speaking with you directly. In terms of the central point, I don't know if you've got a bit more of an answer on that, Sarah, because you were involved in it probably earlier than I was, to be honest.
Yeah, I mean, I think historically, those who've been around a while will know that we used to have the flag service, which was the central information and advice service really in Stockport. And then with the recommissioning exercise, that kind of signposting function went primarily to the TPA and the WIN. Our own contact centre obviously does some signposting and information and advice as well. But I think that central hub that you described, Claire, probably doesn't exist anymore in the way that it did with the flag service. I wasn't involved with the recommissioning myself, but I do know that was a really valued service for exactly the reasons that you described, Claire. You know, people often like a single point of contact. So I think services are all doing their individual bits, you know, to signpost people on, but we don't currently have that central hub. So I think that's really useful feedback, Claire, you know, that we can certainly capture as part of this. I'm sure others on the call probably have a view as well.
And it's clearly what the carers are asking for as well, isn't it? So it's coming across through the survey as well. So it's what people are asking for.
Yeah, and obviously Signpost does an amazing job of acting as a hub for lots of carer services and signposting people in to carer services. But I think it is a bit of a disparate offer at the moment, you know, with lots of different services doing their own bit to signpost and offer information and advice. So hopefully that answers your question a bit, Claire.
Yes, Sue's got a hand up, literally.
Sign at the bottom to put your hand up online. Aimee, on the survey, I filled it in, and since lockdown, I have become a carer for my mum and dad because they're stuck in and isolated. So even though I work full time, I go around every night after work and I see them at weekends. So when I fill the survey in, I wonder if some of those answers where people didn't give a reply, which were very high in a couple of cases, people like me who, although I consider myself an unpaid carer, I don't access any services. So when the question went on to the services, do you access? Well, I wouldn't have been able to answer that because I haven't accessed anything. So I wonder if that's why you got a couple of very high.
It could well be.
It wasn't anywhere for me to answer.
Yeah, I noticed that 56% number. It's like, well, carer service, do people know what carer service means? Because for me, when people don't answer questions, they often don't understand the question.
I couldn't answer because I hadn't accessed anything. So there was a couple that I remember, and I think they're those.
And that's potentially, you know, the case is, you know, maybe there wasn't that space for them to answer. There wasn't, you know, a clear understanding of the question. So hopefully that as we go forward and, you know, maybe to do some more consultation, is that we can allow people the opportunity to give more of their opinion across differently that weren't able to previously with the format of the surveys. It won't be just, the survey is a good, you know, a good part. It gives us some good data, but it's one part of it. It's not necessarily the whole of that feedback that we will get going forward.
And also, just another question is, as part of the commission, you have a limited amount of money. If it's going somewhere else, then it's being taken from one of the other services in the commissioning, got 2022 commissioning offer.
I missed a little bit of that. I think you went a little bit quiet in mid-sentence.
Right.
So
is it?
Sorry.
Will it be because money is going to be going, more money is going to be going to one service? Is that going to be taken from another service that's already being commissioned, or is it all going to be completely different going forward anyway, recommissioning in 2022?
Yeah, I think it's probably, you know, we're doing a big piece of work around the preventative services commissioning, and I think, you know, aware of some of that. So so we will be looking at it generally as a new piece of work. So I think things could potentially, I don't know what it's going to look like at the moment, but it could potentially be different to what we currently have. So I can't say anything about what funding we're going to get or how that will be split up. But that will be, you know, a lot of work and consultation will be, you know, with yourselves and with others, we'll be going to look at look at what is required and what people need, and to make those, to make an informed decision about where that will go.
It might be useful just to give a bit of context to that as well, because I know there's probably a few consultation questions, and if some of you were at the last cross-sector network, you'll have noticed that we are pushing, Sector 3 are pushing for a commissioners conversation, so a chance to actually pose these questions and get to the bottom of, because I think what the sector find is that it's really hard to have these conversations and to get around the table with people who can answer some of this stuff. So the bigger plan for Sector 3 is to get a range of commissioners across the council and public services to come and speak to us so that we can have a bigger conversation. So anything that Aimee can't answer today and is more generic, I will take note of and make sure that that is brought up as part of the next level conversation. Is that okay? Abba, you've got your hand up.
You're on mute, Abba. She's not heard me. Can't hear you.
Tina told me I need to get a t-shirt that says mute.
We need to hold up a little sign for you, Abba. You're on mute.
Yeah, but Aimee, thank you very much. It's an insightful presentation. I just wanted clarity on, say, refugee carers per se. How do you engage with those people? Because I know there's a lot of carers who are refugees, but they might not be able to connect because of language barriers, because of so how did you connect with example people like those to get their voice heard so that they could be actually part of what you're trying to improve and do?
I think that's a really good question, Abba, and I think that's something that we'll need to look into a bit further and get probably your support and guidance in making sure that we access that properly. Obviously, the survey online so far was it was circulated amongst a variety of organisations. Whether it's been captured and been made accessible enough for refugee groups specifically, I don't know, but we need to make sure that we have that conversation as part of this consultation.
Thank
going
you.
forward.
The reason I'm asking is because we've got this idea, and we put, like, when we say Black, Asian, minority, ethnic, we just kind of clump it all into one, where there's you get sections and different cultures, different different kind of grouping, but we are clumped into one setting. And what then gets missed out is really the support that's needed within the individual grouping. I just wanted to bring that to your attention. That's all. And
it's important that we accept, look at carers across all sorts of groups and how they access and what they need, because in some respects some of those needs may well be different. So that's why we need to get as wider feedback as possible to make sure that we don't miss anybody. So that's a really good point, Abba. Thank you.
I think that's one of the massive benefits of stakeholder feedback, because as Aimee said, we will have circulated that survey far and wide, and we probably captured some feedback from the likes of, I know Stockport Homes work specifically with on the rehousing side with refugees, former asylum seekers, and Abba, yourself obviously have really wide networks with different communities in Stockport, so hopefully some of that has been picked up, but that's why stakeholder feedback is just as important as feedback from the public, because you can signpost us to groups, as you say, specific groups that we might not have reached, and we need to have a more of an accessible approach too. So so any feedback like that is really appreciated, Abba, and we can build it into, as Aimee said, we'll be doing further consultation to inform the preventative recommissioning, so we can look at building that into the consultation for that specific piece of work. Any other suggestions are really welcome from anybody else if you feel that we need to target specific groups. Thank you.
Sorry, Diane?
Apologies for being late. We got stuck in traffic today.
It's good to see you.
We got here at last. Therefore, I don't know if there was a conversation at any point in regards to looking at carers of people with severe and enduring mental health issues. I do know that there is there's some carers groups for people with long-term mental health conditions. But for myself personally, on a personal level, I'm a carer for somebody who's not working age. So my partner, who is a same-sex partner, I've not been able to find anywhere where I've actually got any support from. And because they have a severe and enduring dual diagnosis, then it does actually get quite difficult, and it would be useful to be able to have those conversations somewhere. But the point is, I know Stockport very well, I know the system, but I still cannot find anywhere to go myself. So I don't know if that conversation's being held.
I think I think the survey went out to mental health groups, but similarly to what we were just saying, Diane, if there's specific needs, then we need to pick them up and hear your voice as part of the ongoing consultation. So, it'd be good to pick up perhaps with you separately, Diane, for your views on how we can make sure that the needs of, loved ones and people we care for are captured fully.
In fact, as much information as we can get is really important. So, anything you want to send through is really valuable. That we don't want to miss anything. So,
I appreciate you saying that it's gone out to organisations. But I actually am part of a mental health registered charity based at Stepping Hill Hospital, and it's been there for 20 years, and we've not had anything about a consultation. So we specifically work with people with severe and enduring mental health issues. So if we could be added to that list, I would be very grateful. Thank you.
Yeah, absolutely. And apologies that it didn't reach you through any of the methods that we got, but like I say, we have got that opportunity and that time now to to get as much feedback as possible, and I've said that that's really important. So we will make sure that gets through to you. So thank you very much for that, Diane.
Thank you.
Is that stuff, Diane? Is that the stuff service?
It is. It's a different service now. Right. So we are now a registered charity, and have been for a while. So it's a different delivery of service.
Okay. Apologies, I'm a bit out of touch with service provision in that area, but yeah, we'll definitely make sure we include you going forward, Diane.
Okay. Thank you.
Thank you.
Do you have any more questions for Aimee or Sarah? No? Okay. Oh, yeah, Rebecca. Rebecca's got a question.
Hello, Rebecca.
Hi. I was just wondering if it was the results of the survey itself that's actually part of the reason why there's the delay in it's changed to 2022, or were you guys kind of already thinking that you might do that?
It certainly kind of cemented that decision for us, because like I said, we kind of had a pot of funding, and we were testing the water, and when we went out to did the survey, and the feedback that we got, we felt that we wanted to put more investment in it to truly deliver a carer service that would meet the needs of carers as outlined in that survey. So that's why we decided we'd rather do things and have a robust and a proper service for carers rather than do something that we thought might be just a little bit papering over the cracks and a little thin on the ground. So that's why we decided to do that. And we want the best service for our carers, obviously, and so that's why we made that decision.
Okay, thanks.
As a lay person, Aimee, and I don't know a great deal about this, so if there's been a delay in commissioning until 2022, is there an interim plan up to that point, or is it the plan to stay as it was?
At the moment, those services that we we're already commissioning, as I outlined earlier in the presentation, have been extended up to the point when we will recommission. So it's business as usual, so to speak, at the moment. And then hopefully, obviously going forward, we'll have a more robust service in the future.
Okay, perfect. So I'm going to stop recording. Thank you.